Well, it sounds like most people have taken their food break and have trickled in. So let's get started so we have more time to talk. So welcome everyone. I'm Phil. Welcome to the webinar. We've gathered some marketing leaders and even a CTO from a bunch of digital healthcare companies. And we're going to talk about growth in 2022. We're going to look forward to 2023 and beyond and see what's going on and what people are thinking about and doing. Just to lay the groundwork, I'm going to moderate the first 25 minutes or so. We're going to go through a couple of questions with the panelists, and then Talif will jump in and moderate Q&A at the end of the session. You can use the Zoom Q&A feature, which is somewhere over here, to put questions in, and then Talif will ask the panelists for that. So let's go around and introduce everyone, what they do in their current role, and share something you've learned in the past couple months. I'll introduce myself. I'm Phil, founder and CEO of FormSort. What we do is we're a HIPAA compliant form flow builder that's used by dozens of companies in healthcare to do things like patient onboarding, clinical trial data collection, and doctor visit follow-ups. Our customers save money by not needing engineers to build forms. They improve conversion by launching A/B tests, and they improve patient experience by focusing on healthcare and not technology. And my one thing I learned in the past few months is that veterinary healthcare is pretty expensive, just like human healthcare. But don't worry, my cat's doing just fine. She's asleep right over there. With that, let me hand off to Talif, who will moderate our Q&A later.
Awesome. Thank you, Phil, and good afternoon, everyone. My name is Talif Lindeval. I'm the founder and CEO of ADM. We are a growth marketing firm based in Chicago. At ADM, we specialize in paid search, paid social, and programmatic services that accomplish aggressive growth goals on behalf of our clients and also protect patient privacy. We also offer HIPAA-compliant analytics solutions and HIPAA-compliant direct mail services. Our teams and our processes have really been designed to support companies specifically within the digital health space. In our partnerships, we address a range of opportunities to improve patient journeys when building our clients' acquisition programs. And as far as what I've learned in 2023, I think it was actually from a 2022 study, but it's that in the next 3 to 5 years, there are projections that hospital systems are expected to lose up to 20% of their market share to direct-to-patient health solutions. So I think relevant to probably most people in the audience today and the work that we're doing, but just looking forward to being a part of the conversation today, and thank you everyone for being here.
Cool, thanks Talif. Now let's introduce our panelists, starting with Caitlin.
Hi everyone, thank you for joining today. I'm the Chief Marketing Officer at Talkspace. I've actually only been in the role for about 3 months, but was formerly the Chief Marketing Officer at Nurex, which was acquired by 30 Madison earlier in the year. I'd say the biggest thing that I've learned this year is, you're going to laugh at this, but learning how to work remotely. Why? Because through the entire pandemic, I lived so close to my office that I got a group of people to come together and go to the office every single day. And so now that I'm in a truly remote role, I'm just starting to learn that. If you're not familiar with Talkspace, we are one of the #1 online therapy providers. We've been around over 10 years. If you've seen the Michael Phelps commercials, that's where you might have remembered us from.
Great, welcome. Next up, Stephanie.
Hi everyone, Stephanie. Great to see everyone on as well. I'm one of the co-founders and CTO of Nourish. We connect individuals in need of nutritional counseling with registered dietitians, and we get the services covered by the patient's health insurance. I've been working on the company for about 2 years now, and I'm normally based out in San Francisco, but currently in New York. And I think one big thing that I've learned this year is actually kind of the reverse of Caitlin, is how much I've loved working in person so far. So we have an in-person office that we just got about 4 weeks ago out in New York, and the team's been building out here. So I'll be shortly moving from San Francisco out to New York. But yeah.
Great, welcome. Meredith, would you like to say hello?
Yeah, thanks, Phil. Hi, everybody. I'm Meredith Valentine DuPont. I just got married recently, actually, so I kind of forget my new last name sometimes.
Congratulations.
Thanks. I'm from Cue Health. We're a healthcare company that's really working to change, the how and where care is delivered for both consumers, healthcare professionals, as well as employers and the public sector. So we have diagnostic tests and a range of telehealth and treatment options coming soon as well.
Awesome.
Oh, and something I've learned this year, I learned how to do the Wednesday dance on TikTok. Which I won't make you guys all watch, but it's kind of fun.
You're learning how to
Yourself
marry.
up.
Yes.
Cool. And last but not least, Nicole, welcome to the webinar.
Hi, I'm Nicole Mattern. I'm the VP of Growth at Calibrate. And if you're not familiar, Calibrate is a comprehensive weight loss and metabolic health program online. And we combine telemedicine and doctor-prescribed medication called GLP-1s, which have actually been very buzzy in the news. Maybe you've heard of Ozempic. So this is one of the medications that we prescribe, for example. And sort of a comprehensive coaching program. We help members lose weight sustainably and are pretty proud of the results we've been able to drive for members long-term, and to have a D2C offering as well as a growing sort of enterprise and business offering. So that's me. I've been with Calibrate for almost 2 years now. Something that I have learned this year, I've learned just like how many things babies need. I'm expecting a child in a couple of weeks, and I'm amazed of how many things they've thought of, gadgets and things, and just also how the guidance has changed over the years. So have had a real indoctrination into all things baby care. So yeah.
Congratulations. It's really exciting. Well, let's get started. To kick things off, let's take a step back and think about 2022. It seems like so long ago. How did your teams approach growth last year? Like, what assumptions did you have back then when planning, and would you have kept them the same given today? What would you have changed? And to start that, maybe I'll ask Caitlin or Nicole. Do you guys want to take that one?
Who's first?
Caitlin.
I'll go. All right, sounds good. Yeah, so I would say, speaking a little bit to Nurex and 30 Madison, I'd say we kind of started more as a normal growth year, with growth being number one, because I was there for most of the year. I'll speak to that. But, ultimately, I think with the macroeconomic environment and, everyone in digital health on the path to profitability, maybe not everyone, but I think most of us are looking at that path, really started thinking about optimizations within the product, partnering closely with our product team, not, trying to just get out of the sort of paid growth marketing piece, focusing heavier on CRM, organic channels, and then expansion with demand channels like how do we take advantage of Performance Max and things of that nature. I'd say the other big area of focus, and this is really after being in digital health now for a while, I have never been so operational heavy from a marketing perspective in looking at the path of the customer when they come in, all the way through the many, many, many things that can happen to them, especially in a world where we're taking insurance. So everyone knows if you're taking insurance, all of the things that might happen, from rejections to going to a different pharmacy, all of those things, and working really closely with operations to figure out how to close the loop so that we don't have to rely on the top of the funnel ultimately as much.
Cool.
I would second a lot of that. I think probably for many of us on this call, it was a little bit of a tale of 2 years, where you have the beginning and then you sort of have the shift as things kind of changed and priorities, for many really turned to path to profitability sort of quickly, maybe over sort of, scale, and sometimes scale at any costs. And so I think as part of that pivot, it's really interesting as a growth leader, but it also forces you to sort of evaluate, your channel mix and your strategies, as Caitlin was sort of saying, and think about, maybe where are there areas where I have faster payback versus slower payback, or what are the organic levers versus kind of the paid levers. And so that was definitely something that we sort of thought about. The other thing that I think in hindsight is interesting is it depends on the category that you're in, but at least for Calibrate, there was a lot of like innovation and change in the category throughout the year, and a lot of new entrants and new competition, especially as there became more awareness of the medications and the GLP-1s that we prescribe. And so I think something that maybe in hindsight we could have done more of, and it's definitely a part of our 2023 strategy, is just thinking about how do we want to participate in kind of that change in the landscape, and what do we want to do offensively versus defensively, from a brand messaging standpoint, from an acquisition and channels and whatnot, and having that be a more core part of the strategy, from the forefront versus something that was a little bit more potentially reactive. And so that's something we've really taken into this year.
Yeah, I'd say
Interesting.
one other thing to add to that is, taking a closer look just from an efficiency perspective at more in-market prospects. I mean, from a therapy perspective, the awareness, the destigmatization from 2020 through to today, the amount of people who are actually in market for what we do is extremely high. And so what that ultimately means is really pulling back in the top, top of funnel channels, and really focusing on building the brand through things like UGC, influencers, really figuring out how to make organic social work better for the brand, again, so that we can pull back on some of those awareness driving channels and figure out how to drive the awareness through people sharing.
One thing I want to ask is, maybe Meredith, speaking of change in the environment and in the market, like Cue Health has done a lot with COVID. I'm curious how that's affected your work, both in the past and now going forward.
Yeah, it's been interesting. So, our first product in market was a first at-home PCR quality COVID-19 test. And so we were really riding the wave of the COVID pandemic in terms of scaling and growing, and really we had more demand than we could meet. So to Caitlin's point about, there was a very large in-market group already. As COVID has waned, there are still segments of the market that really still need that high quality testing quickly. Sometimes, we found some good success in the traveler segment throughout the year, even as, COVID generally was, on the decline and offices were opening back up. I think those who maybe traveled more often or had immunocompromised family members, we're definitely still in market looking for solutions, especially as government programs are going away, or some of the access that they may have had was going away. But now our challenge is, how do we pivot and get ready for the roadmap of what's next? So, we had a lot of products in our pipeline already, but with COVID, that was prioritized. So now we're really excited for what's next in respiratory health and sexual health.
Awesome. And I guess one thing question wise for you all is, like, of course, budgets are tight right now. And, we still have to do growth and still have to build your brands. How are you guys thinking about that in terms of tooling and staffing and things like that? Maybe I'll start with Stephanie to get the CTO's perspective.
Yeah, absolutely. So I think from like a technical perspective, what matters a lot is just like the speed of iteration, both on the product engineering team, but also on the growth and marketing team. With kind of the changing landscape, like what's most important is really just being able to test things very quickly and not having different teams bottlenecking each other. And so we are a customer form sort, but I think it's huge that our engineering team, our growth team can all independently make very fast changes to our funnels, very independently of one another, and being able to run many experiments very quickly is honestly what we've been really prioritizing, even when a slimmed down team. And sometimes I think with a fewer team members, it actually adds to the speed of iteration occasionally. I'd say the other thing that we focus on is just really being diligent about what we care to build in-house and whether we think it's going to be a strategic differentiator for us down the road. For me, I personally actually think that speed matters almost more than that second half. You can always build something once you have high confidence that it matters, but just being able to quickly understand and unlock every team member across the funnel, across all product areas and functions has been really core to us.
That's great. Are other people doing stuff to make teams self-sufficient? Yeah, go on.
No, I was going to say one thing I might just add that's been really helpful in terms of budget and, needing to make changes there and figuring out kind of the implications is just making sure the team has like a really deep understanding of the funnel mechanics of in any given month, like what percentage of your revenue or sales is coming from new leads that you acquired and new people you brought into the funnel, especially if you're a more high consideration product, versus what percentage are people that maybe you reactivated with CRM or coming from word of mouth or something that you're not kind of plugging with media spend. And then you can really understand the implications of like, if I throttled spend this month, am I really going to feel the pain of it immediately? Or is it going to be 3 months down the line that I'm going to feel it? And so I can forecast kind of more accurately and pull those levers kind of together with finance with a little bit more precision. And so that's something that has been sort of helpful for us tactically, in addition to like, a lot of the great work on conversion rate optimization that Stephanie was sort of speaking to with funnel testing.
Yeah, I was just going to add, I completely agree. And I love what you said, Stephanie, but being in the new role at Talkspace, I would say among many things, one of the number one areas of focus has been how do we make marketing as autonomous as possible? And that is really just, how do we move quickly? How do we sort of separate some of the pieces that might be tangled in within what has to go through product releases so that we can just go, go, go.
Makes a lot of sense. How do you guys think about like the rest of the year in terms of like where do you think you will be by the end of the year? How will things be different now that we've started, and where do you see everything going? It's a pretty unusual year, of course, for a lot of people.
I wish we had that crystal ball.
What are you preparing for, or what are your what's different?
Yeah, for Talkspace, we've really gone through a major shift where we were historically just an out-of-pocket player. People were paying cash. And ultimately now I think we cover around 100 million lives. And so we're really focused on the shift, from a messaging perspective, targeting really everything that we do to focus on that accessibility and really get the word out. We are just getting started on that journey, and we think things are going well. So I would imagine, 6 months from now, we would probably just know a lot more than we do today, given that we're just getting started on that. The other piece is that I would say, what I don't think will change this year is I think, unfortunately, taking on a lot of risk is not probably where most of us are playing in right now, which sadly just means, maybe not as many new channels, maybe testing channels that are, a little bit more flexible. But again, I think if we can really focus on storytelling with patients, focusing on organic and being creative with UGC, we can sort of offset the conundrum of not really being able to take these big, risky bets with new channels, and just sort of, look at those as a new channel ultimately, which is what we're doing.
And I would say, I think we're working with our existing customers to figure out what can we offer that they really need in the situation they're in today versus the situations they were in a year ago. So again, a year ago, we were doing a lot of on-site testing, high throughput testing. Now we've got new products coming, in different healthcare spaces. And so we can, talk to employers about what's next for keeping their workforce healthy. We can talk to healthcare providers about how to, integrate care at their practice or point of care, medical clinics. A lot of things changed with COVID. A lot of care is now going to where people are, as opposed to bringing people to where the care can be received. And so, I think working closely with our customers, so we're not making as many guesses or taking as many risks, like Caitlin, you said, and really, knowing and trying to partner together to, create and customize what's going to be the most useful and is really going to, help our customers where they are today as well.
Yeah, building on what Meredith was saying, I think a big focus for this year is kind of more deeply understanding where the prospective customer is at based on the shifts in the market. So specifically for Calibrate, there's been a lot of shifts in the landscape and a lot more awareness of the solution, probably like 50x from where it was a year ago. And so what does that mean in terms of the messaging that's going to resonate for a consumer that's increasingly educated and perhaps a little more down funnel? And how do we think about, standing out when, it's increasingly sort of a commoditized space? And so I think that's been a real focus, a lot of interesting work around messaging strategy, differentiation, social proofing and trust building, and thinking about how you can really take a lot of the foundation that you build and then apply it to like a different landscape that has changed and a different consumer. And I think, sometimes you feel like you do sort of persona work or you understand objections and then you've got it. But like, if your landscape really changes, like a year later, it can be totally different. And it can be kind of a different person that you're going after, and a different set of objections or questions that they need answered in order to pull the trigger. And so I think it's getting just like really in tune with that. What does that look like for us today?
Yeah, I think for us, a little bit twofold from the overall philosophy. I think we're just trying to narrow down, similar to just doubling down on what works already today, narrowing our focus, and simultaneously trying to up the speed of the team that we have today to like run at those things that we know work. And then on the growth side, just doubling down on the channels that have proven really fruitful, will continue to support a lot of growth. And then on the product and engineering side, the natural business of taking insurance, there's a lot of things that are sometimes out of your control, a lot of experiences that can result in subpar patient experiences. So just making sure that we're really delivering on a world-class patient experience, and that we're like the most compelling offering out there for them. And so that's kind of just a high level for us this year.
And yeah, I know no one has a crystal ball, but it sounds like you guys are doing really great things. One thing I'm curious about is maybe just like anecdotally, what are some campaigns or things you've tried that have worked surprisingly well, and were kind of unexpected successes? And then conversely, what are things that have like not worked out that you were really interested in? I'm curious if anyone has a story to share with the group.
I could talk a little bit about our, we just did a New Year's campaign, and I know, for all of us in digital health, New Year's is sort of like our Super Bowl, right? Like you're never going to have a better performing time probably than January. And, coming in new to Talkspace, and the fact that we've had Michael Phelps as a part of our brand for quite some time, we were certainly trying to use our resources and be as scrappy as possible. But we did have a New Year's campaign, just around starting from the top, mainly combined of messaging and using the resources that we had. And it was a huge success. People are still very interested in January around evaluating all of the services that they're using. And so, we didn't necessarily expect it to perform as well as it did, because it's sort of a little bit same old, right? But it did. It was really interesting. We made a great press story out of it. Obviously, it helps to have Michael Phelps kind of talking about what he's doing in the new year for his mental health and making those sort of relatable comparisons. But yeah, don't discount the sort of a little bit of creative messaging and scrappiness. And I think is also another important point as we're talking about cost savings and efficiency. Not just from a media perspective, but from a like operating expenses and creative perspective. And this is why I keep talking about UGC. Don't discount the super efficient, cheap, scrappily made creative. You just have to test a lot of it. But it's a great way to find savings in your operating expense that ultimately you can take to the bottom line or put back into media.
I'll add one.
Oh, go ahead.
So, for Cue Health, last summer as COVID's waning and, generally respiratory season is a bit lower, during that time of year, we had a hypothesis that maybe parents would still be interested, as kids are going back to school or back to daycare in the kind of August, September timeframe. And we tested, small budgets and a couple of channels on like, the old favorites, Facebook, Instagram, and search. And we weren't really seeing great performance, even in terms of emails that we sent out to parents, weren't getting great conversions. But we actually tried Pinterest and really found success there with a parent's audience. We had some pretty great ROAS results there. from the parents' audience specifically, over $5 at that point in time. And so it's kind of interesting. I think there is that iteration of like trying something again in a couple of different channels, because the audience you're looking for may not be looking for your kind of content in that channel, but with the hypothesis, this is still the right audience. We just have to figure out where's the right environment to talk to them about this message that they're going to be most receptive to it. So that was a positive surprise campaign for us this, I guess, into the fall back to school season.
Love that.
And Nicole, you have something?
Oh, yeah. Just sort of on a messaging and campaign note, something that was kind of interesting was that last year we ran sort of a full-on campaign for World Obesity Day, which was actually just happened recently again. And it was sort of provocative around deleting the word obese and talking a people first language, and it had a very like buzzy, provocative kind of openers. And it was a brand campaign, but so the intention was not necessarily for it to be an efficient on an acquisition front, but growth team was definitely involved. And the engagement was like incredible. And so I think it was really a testament to that, like when you have something very provocative and buzzy at the top of the funnel, you can get a lot of amazing engagement, but the pull through kind of into conversion in the funnel was pretty weak. And so as we sort of approached this year, we've been taking that lesson of actually found like somewhat more of a winning formula that works both kind of from a brand and a hook perspective, but also can pull through the funnel. And it was, kind of inspired by some of the learnings from World Obesity Day. We found good success with really thinking about what are kind of provocative one-liners, openers, things that we can do to kind of grab attention, whether it's the CRM channel or a paid social channel, but then thinking about how we actually bring people along on the journey of answering their real questions, their real objections with risk mitigation and offers and things like that to actually close it out. And that's been a really sort of, helpful insight for us in like balancing those two things and how do we do that successfully and have it be ROI positive. And so, yeah, it's been a good journey.
Awesome. Stephanie, do you want to add anything, or we can switch to the Q&A?
I'll add, I guess, more from like the conversion perspective a little bit, so less on the marketing creatives. But one thing was we have a lot of different distribution channels, and across the many different channels, there's obviously a slight change of messaging between all of them, like whether you're hearing about us through your doctor, a provider referral, B2B partnership, paid, non-paid, search, and all of those different things. And so we've really focused on having the growth team work really collaboratively with our customer success team as well to kind of see the biggest objections that people from these various kind of sources are having. And so sometimes insurance might be explained a little better in one context and a little worse in another context, or maybe there's a little bit of a confusion that we have to clear up. And so we've really let that drive a lot of our iteration on kind of like making sure that when someone gets to our page that they're still pushed through the funnel and converting well, despite kind of a lot of different ways that they can hear about us. So, yeah.
Cool. Well, let me hand it off to Talif. There's a bunch of questions in the Q&A. So why don't you take it from here?
Thanks, Phil. Yeah, we have been getting some great questions in the Q&A, but for those of you who have questions and still have not submitted them, now's a great time to do so. So just type them in the Q&A and I will see them. The first one is from someone anonymous, and it's a doozy. So naturally, I'm going to direct it to you, Caitlin. But this first question is direct-to-consumer healthcare dead? And to add a little bit more context, we keep hearing about how CACs are too high. This isn't sustainable. We continue to see valuations fall. Is this a course correction, or is D2C healthcare dead?
Oh my gosh, you're giving that to me. Of course not. I think, from an investor perspective, a lot of the D2C mantra is really just viewed as a person paying out of pocket. And the reality is, and again, Talkspace, we used to be a company that was solely focused on out of pocket. And I think many of us here also have made that shift to coverage. But I think ultimately the barrier to getting good healthcare is always cost 100%. And so the more that we can sort of offset that and drive mass awareness and adoption and access, the more that we can really open up the market. And I see that ultimately that is the trend. That is what companies are doing. And ultimately, if you do that, you'll be able to increase the whole pie for, for people who are coming in to use your service. And actually, when you do that, you end up seeing more out-of-pocket patients because people come in, they check their coverage. So ultimately, I think the trend and where we're moving towards is not about like, is it D2C, is it not D2C? It's really just about the customer experience. Because even at Nurex and now at Talkspace, the person from, day 1 to day 2, whether they have coverage or not, is still the same person. They're still on TikTok, they're still on Facebook. So I think that if we can really figure out how to focus on that, total customer, regardless of how they pay, and ultimately open up access, we'll be able to drive a bigger pie. And hopefully some of these conversations will go away, especially as we, are continuing, everyone's optimizing our media and, doing all the things that everybody talked about today. So that's my thought.
Great. Well said. I'd have to agree with you. And moving on here, Stephanie, directing this next question towards you, and this is not a press conference, so feel free to pass if you don't want it. But with regards to, mentioning Facebook and this other question, this states, how are you managing increasing privacy concerns on Facebook and Google? They won't sign BAAs, as we all know, and reporters are digging. How are you thinking about it in the CTO seat?
Yeah, I'd say right now we don't have any spend on Facebook, so perhaps better directed to someone who does. But in terms of privacy concerns, definitely we make sure that we're HIPAA compliant across the stack. So have BAAs with all our vendors similar to FormSort, and are very mindful of when we are using other vendors that do not sign BAAs to be programmatically removing information that is sensitive, considered PHI. So FormSort has this off the box, but we also use a lot of kind of like CDP platforms that automatically will scrape IP address, name, email, sensitive private like PHI information before sending it off to any third-party platform that refuses to sign a BAA and therefore should not be receiving that information for tracking or signaling purposes.
Great. Yeah, definitely coming under a lot of scrutiny, but as you spoke to, I think there's a lot of productive ways that digital health companies can be cognizant about protecting patient information and maintaining privacy.
Your head of compliance and your legal team should be your best friends. Let's just say that.
Directing this one towards you, Nicole. Caitlin already talked about seasonality and the turn of the year really being digital health companies' best friend. I would expect that's consistent for you as well at Calibrate, new year, new me. This question asks about seasonality specifically. Yes, there's long-term market change, but how is that different from non-seasonal growth? And what do you do differently during the high season versus the low season? Can you speak to that?
Yeah, definitely. I think probably for many of us on this call, it is sort of the peak area time for Calibrate. It's very extreme in many ways, just given that we're in the weight loss space and there is such momentum around New Year's resolutions in that sort of time. And I think we build our growth plan around it, right? When we think about our forecast for the year, when we think about even staffing through operational teams and whatnot, how we need to staff up to take an influx of people, it's definitely sort of it all comes into account in that respect. From a media perspective and from a forecast perspective, what we've typically done is kind of taken an approach of like, get it while the going is good. And you have a little bit more potential, flexibility on the CAC side. And that's what I've sort of advocated and modeled out, which is like, hey, we have an opportunity to spend a lot more media right now and do it with more target efficiency than we're going to in May, for example. And so this is the time. There's more market share, there's more opportunity, there's more interest. So allow us to go and get it. The CAC is going to be a little bit higher in this concrete period of time because we're kind of spending more money as a percentage of maybe what our like organic baseline is. So the blended CAC is a little bit higher. but our paid CAC is, we have the opportunity to scale it like we don't at other times of the year. And so have really thought about making sure that I'm thoughtful about how I can like model out this opportunity to the folks on our finance team and our leadership team, so they understand and are bought in kind of with the approach. And I've also thought about like, can we pull all the stops, right? Like Calibrate is very selective in terms of discounting and promotion, but have advocated for during peak season, we throw that lever into the mix as well, so that we can really capture the demand of the moment. And so it's certainly been a time that that we have kind of put a lot of eggs in that basket, and it's been impactful. And I think that when you're going to have a lot of captive people who are really, really high intent, I have always recommended that like you should seize that opportunity, because you don't know the future. You don't have a crystal ball. You don't know what's going to happen in several months or how the market's going to shift. And so if this is the time, and you can look at Google Trends and you can see very consistently, this is the time that we can capture intent. Let's go and do it. Yeah.
I would just add to, we've done a cohort analysis looking at the groups of people that have come into the business in different months and kind of the LTV and the retention of those different months, to also try to figure out, whether it's seasonality or, those that come in the low season are more committed because, they were coming when it wasn't such a hot thing. But that's kind of been an interesting analysis to try to help us figure out like, what is our real seasonality versus what is our perceived seasonality based on the customers who've actually come in and how they perform over time.
Are you seeing different lifetime value based on the seasonality of customer adoption?
We have seen it a little bit. We've only done it for about 13 months. That's about the length of time that we have. So I'd like to see it continue on, but it's been a very interesting kind of first look and kind of peek under the hood there to see those that came in kind of when COVID in particular was like really high, versus those that came in when it was a little bit lower. And I think those that came in when it was lower, the ones that have kind of all like needs along the way for a long time. Again, like I mentioned, travelers or business people or immunocompromised folks who that's a condition they have year round, versus those that, came and bought during respiratory season when there was an acute need and, maybe aren't testing as often after that, season has concluded. So we'll see when we have more products out there, for different needs, if we can create some more consistency in the business, because it is nice to flatten out those seasonality curves a little bit from a business perspective.
Yeah, I appreciate you speaking to that, Meredith, because it prompts a specific question that I actually had from you. So I'll take my own as an audience question. But I know Cue recently launched 13 new at-home test kits, really diversifying your product lineup. How does bringing awareness to new product launches integrate with your existing marketing strategies, especially keeping in mind that everyone here has a very performance-focused lens on their marketing investments?
Yeah, I think we're sort of starting from the bottom up in terms of the performance funnel, and focused on finding that market that's already there, that's in this market. The 13 tests that we have range from food sensitivity to sexual health to women's health. So they're areas that we know are popular, and there's already a lot of folks in those markets. There are also some competitors in those markets. So we're working on some messaging testing to understand how we can really differentiate ourselves in that market, and also, how this can be kind of our lever to pivot from Cue as a COVID-19 company to really Cue as a healthcare company. That much broader brand positioning, and how do we use this as a platform to establish ourselves there, which is really exciting. So we're doing some small test and learns right now to kind of scale this up, and then we'll plan to have a bigger launch with some of those learnings included.
Great, thank you.
Will there be a Super Bowl ad, Meredith?
Well, we did do a Super Bowl ad. I think my first week at work was a Super Bowl ad. So that's a pretty big onboarding experience, I'll say. I don't see it in our near future, but if anyone's interested in results of Super Bowl ads, I'm happy to chat about that.
Maybe a future webinar in addition to the balance between brand and performance initiatives, which has come up a couple of times on this call. Caitlin, another question for you, because I've seen you do this over the years with a range of budgets, but this question's about testing. How do you balance testing and flighted strategies? I think an example would be a one-time podcast buy versus ongoing investment in your evergreen marketing tactics, your tried and true performers.
We try to just really keep it flexible and keep the spend low enough from a testing perspective that we're comfortable taking it from our sort of worst performing media at that moment. Again, to just kind of diminish the risk a little bit. So, we're not going to be doing, $300,000 to $500,000 test buys really at all. But if we can do something that's pretty flexible, that, doesn't need a huge amount of spend, like the podcast test that we're doing with ADM, then we know that we can sort of come in and say, okay, like maybe we have some search terms that aren't performing as well, and sort of shift that budget over to the new test.
Great. Thanks for the shout out too. I've got a question for you here, Nicole. How do you think about growth levers and triggers, for example, discounts? What are the levers that are best for you, and how do you strategize about using them and not exhausting them?
Yeah, I think it's going to depend on your product and your category and your audience. Specifically for Calibrate, we have really tried not to exhaust and utilize discounts in a super evergreen fashion, and really thinking about like this one big moment a year that we're sort of leveraging for the New Year's moment. But that can change if, for example, if your space is getting really crowded and all of your peers are coming in with a certain kind of pay model dynamic where maybe first month is discounted, or there's, a sort of an always on sale or something like that. That's something that I think you should evaluate and think about holistically. Is this right for us? I would also, try to get to the heart of like, what is a discount really doing? And to me, it's kind of like creating urgency, but it's also risk mitigating. And are there other ways that I can do that? And so, for example, one of the things that Calibrate has, which has allowed us, I think, to not be too discount heavy, is we implemented some guarantees within sort of our product, a results guarantee. And at time we had a guarantee around sort of medication coverage as well. And we saw those be more transformative than any discount, because it was really we were providing a money back guarantee on the thing that the person wanted, which was results, long lasting weight loss results. And we could do that at checkout, and that could potentially actually offset some of the risk that they were feeling, more so than saving $100 or whatever. So that's what I would sort of advise, is like, you understand your customer and what they're really looking for. If you have a very price sensitive consumer base, like discounts might need to be a pretty core part of your strategy. But if you have maybe a more expensive product and you're working with people who maybe can afford to pay a little bit more and are thinking about a long-term investment, there may be other risk mitigation factors that are going to be more effective than a sort of short-term kind of discount.
Great, super insightful, Nicole. Thanks for sharing that. Question to Stephanie here. Bear with me. Do you have any advice on how you build a robust data infrastructure for marketing and operations teams to let them use or give them insights in the digital healthcare field?
Yeah, I think
I'm
this is
sure
going
you
to
can knock
vary.
that out in a couple seconds.
I think this just varies a lot, company to company. I'm sure, what we consider, what we measure, and what we think of in data will change depending on your business model, what third parties you interact with. For example, we don't interact with any pharmacies. I'm sure that adds its own level of complexity, or we don't deliver any physical products, unlike Cue, for example. So I know that operational excellence will look very different depending on the kind of company that you're operating. But at the core of it, I think privacy first is definitely very important. So having a good CDP in place that will, be helpful in ensuring that for your teams, and making it really easy for the engineering product teams to adhere to that, because it's inevitable that there's going to be identifiable information stored somewhere. And so just making sure that when information is getting passed places, getting flagged, things are just compliant there. And then overall, I'd say that tying back to a little bit of what we were talking about on like speed of iteration and conversion funnels and the like, just making sure that the infrastructure is easily in place for marketing ops teams to be able to track and to attribute and to measure their experiments and the success of that. And so, upfront investing in some of that pays a lot of dividends. And I think that's where I see like the engineering teams kind of very closely collaborating with the marketing growth side is frequently on making sure like the baseline is set up so that the marketing team can then operate independently and run very quickly.
Well said. Yeah, I think the better collaboration between the two teams, the more effective your wins are going to be. And then obviously, the ability to deploy tools, shout out to FormSort, can be pretty helpful as well. Keep the tools within marketing. Meredith, last question here and directing it to you. I think your mention of the Super Bowl ad, and obviously I know your focus as a performance marketer makes this a good fit for you. How do you walk the line between simply creating awareness for patients in need and promoting growth in a more aggressive manner? There was a reference to cerebral here, which I'm not connecting you to at all. But I think, that balance again between performance and more brand awareness.
Yeah, I think, we've seen what happens if you just tap the bottom of the funnel and you never invest in the top. And I think Nicole might have been you who was sort of talking to executives about this and saying, okay, yeah, we can throttle this, but we're going to see it, stop at some point if we stop investing here, whether that's 1 month, 2 months, 3 months, you may have different time horizons. But we've been able to, test a few different scenarios of awareness building in conjunction with performance marketing. So one thing we did this fall was actually as part of the Super Bowl buy, we had a connected TV buy on Peacock. And so we were able to see that, in the markets where we had that live, we looked at our branded search terms and how high they were compared to other similar markets where we were not advertising, we didn't have Peacock connected TV. And so we saw a really significant lift in our branded search in those markets. And so we were able to help tell the story to leadership that, because, they see branded search and they see the ROI on that and everyone gets really excited and they're like, do more of that. And, and you have to sort of explain there's a cap. If people don't know about you, they can't search for you. And so, how to show the connection between these two in a really direct way was very helpful for us to kind of have these control DMAs, to have test DMAs, and to have enough budget going, into that connected TV, buy to really show the lift that you can get if you invest in that top of the funnel and how that really does trickle down to the bottom. So that's been one way. And then, we've had a lot of debates, especially in the COVID space, about not using scare tactics. We don't want to scare people into using our products. And so we want to be there to help. We want to be there to support. We want to be there when they need us most. And we want to make sure they know about us so that we can help in those situations. But we've definitely stayed away from that idea of kind of, fear mongering or trying to grow at any, at the expense of anything else, including our own, ethics and what we feel good about promoting in the world.
Well said. Yeah, thank you for that concrete example with Peacock as well. Well, that wraps us up. Thank you everyone in the audience for joining us, and so sorry for those questions that I did not get to. If you have any additional questions or want to learn more about ADM or FormSort and the work that we do on behalf of our clients, please don't hesitate to reach out to myself or to Phil on LinkedIn. We'll also be sending a follow-up email where you can get in touch with us directly. This is the first webinar in our ongoing series. If you have any topics you'd like to see in the future, please let us know. We definitely have some questions that we didn't answer that are some inspiration. I also want to thank you, Phil, for moderating and FormSort for co-hosting this webinar with ADM. Most importantly, Caitlin, thank you. Stephanie, thank you. Meredith, thank you. And Nicole, thank you. Thank you all so much. This was really insightful. Wishing you all a great rest of your day and take care.
All right. Bye.
Thank
everyone.
you.
Thanks a lot. I have a whole page of notes. It was really insightful to hear from you all. Thanks.
Good.
Bye.
Bye.
I survived.
Yeah.
Great.
You sound great. See you guys later. Thanks again.